cuspid tipping and understanding the reaction forces on adjacent teeth. I know the slide in front of you looks a little complicated and many pictures, but I hope to make sense of it as we go through this video. Related topics to this particular lesson that we're going to learn about reaction forces are labial and lingual root torque, opening space for lateral incisor implants, extrusion and intrusion, Cuspid leveling, and bicuspid retraction, aligner biomechanics. Of course, with your subscription, you can visit all of these topics. Let's study sliding a cuspid bodily backwards. We're used to seeing people with braces who have brackets or bands on their teeth and power chains that are placed at the level of the crowns to bring the cuspid backwards. Now, of course, the cuspid has a center of resistance, as all teeth do, and the cuspid isn't necessarily going to want to move back parallel. It's going to want, in nature, to tip over the center of resistance. Now, when it does this, because it has a wire in the slot, the wire would be deflected upwards in the back and downwards in the front. Now, because we have other braces and the wire is engaged in the other braces, we use the force available from the other braces to push the wire onto the bicuspid and lift the wire into the lateral incisor. And when the wire is lifted to the lateral, it puts an extrusive force on the lateral. And when the wire is pushed downwards to the bicuspid, it puts an intrusion force on the bicuspid. This, of course, keeps the cuspid moving back bodily, but there are now action forces, or reaction forces we could call them, on the bicuspid to intrude it and the lateral incisor to extrude it. This would deepen the bite and deepen the curve of speed. And so, in order to resist this, we put in reverse curve of speed. Now, let's try something that we wouldn't really usually try in our orthodontic treatments. Let's do this all over again, but with no bracket on the lateral incisor. If we did this, as the wire would be activated, or the power chain would be activated, the bicuspid might help to keep the bodily movement of the cuspid, but the lateral incisor, the wire would just slip off of the teeth because there's no bracket to engage it. Now, we don't do this with braces, but we do it with aligners. And so what happens in aligners is, if there's no attachments on the front teeth, even though they may not be moving, the aligner ends up not tracking on the incisors because it leaves the incisors, but the cuspid, where the wire is still engaged in the bracket, the cuspid would be seen as tracking. Let me show you a little bit more clearly with aligners. Each time an aligner is made, it's made to eventually make the tooth straight. But when the aligner goes on the tooth, at the moment that the aligner is pushed onto the tooth is not straight. In this case, this tooth, the lower right 3, needs root distal tip. So the root of the lower right 3 needs to move distally. Now, when the aligner is a little bit straighter than the attachment, when the aligner slips onto that attachment, it's going to deflect. And that deflection is going to cause the aligner to lift off the front teeth and push down on the back teeth, just like our wire did. Now, this may deepen the bite of the back teeth by intruding them, and it may deepen the bite of the front teeth by extruding them, but only if there's attachments on the front teeth. If there's no attachment, the aligner will just leave the front teeth and they'll go non-tracking, even though the cuspid looks like it's tracking. So, these same reaction forces go on whether patients are having braces and wires or aligners and attachments. And where we might need attachments to engage the aligner or not can depend on whether we're doing root mesial tip or root distal tip. The reason that I show this in the bicuspid extraction type of situation is that in bicuspid extractions, there's a lot of need to distalize the roots of the cuspids. And this causes cuspids to then tip distal, crowns to tip distally, curves of spi to get deeper, incisors to erupt, premolars to get depressed, and deep curves of spi. And often, when people are looking at their computer simulation and wondering, why is this happening in the mouth? I tell them the teeth will do what they're told to do. We may not realize what we're telling them to do. So let's go back to the lower right 3 root distal need. When the lower right 3 needs distal root tipping, and the aligner is going to be deflected upwards, it would be a good idea to put an attachment on the incisors, unless the incisors have some severe crowding or deflections that will retain the aligner in the front. And by doing that, we'll force the aligner to tip the root distal. But if not, we need attachments. But if we do put attachments on the incisors, we recognize these incisors are going to get an extrusive force, and in order to negate that intrusive force, we'll need extra curve of spi leveling. We'll also need extra curve of spi leveling to negate the intrusive reaction to the posterior teeth. On the other hand, for a lower right 3 root mesial need, all the forces are opposite. Here, the incisors might get intruded by the aligner resting on the incisal edges, while the posterior teeth you might think need attachments and may extrude, but as we know, extrusive forces in aligner biomechanics do take effort. They can be done. And for the most part, the posterior teeth are more retentive than the anterior teeth. And there are biting forces in the back. So we don't really need so much an attachment on the posterior teeth to make this movement effective. I hope you've learned something about understanding the reaction forces on adjacent teeth, and a good example of this is cuspid tipping control. As I said, I encourage you to see these related topics, continue to discover more in our subscription and many videos available like this. And if you do have difficult cases and you would like coaching, please visit us for one-on-one coaching. Thank you.